Claude H. Jr. was an African-American surgeon who embodied the ACS slogan, Science, Innovation, and Moral Values. His exemplary leadership role in American surgery has been widely acknowledged. What was the background that spawned his incredible work ethic and discipline, inspired his agile intellect, and unwavering commitment to becoming a surgeon? He believed that experienced physicians and surgeons have a responsibility to pass the torch and share their knowledge with younger physicians and surgeons. In his eyes, this was his greatest achievement. This video demonstrates his absolute mastery in surgical education in 1973 when he was chair of surgery at Creighton University.
The anterior abdominal wall is the principal access route to the peritoneal cavity, and incisions involving it are employed countless times each day in both elective and emergency operations. This part of the human body, aside from its utilization for incisions, is the site for a variety of congenital and acquired lesions. Noteworthy among these are the penetrating wound of the abdomen, caput medusa as a manifestation of portal hypertension, single or multiple drain insertions are their complications, an epigastric hernia, the abdominal wall flap for extremity coverage, bowel exteriorization as a reflection of drug toxicity, the umbilical hernia, prosthetic graft insertion, a malignancy of the anterior abdominal wall, both primary and metastatic, the postoperative ventral hernia, congenital anomalies of the anterior abdominal wall, a persistent urachal malformation, the abdominal wall hematoma, and a benign tumor such as a lipoma. Of the numerous factors that warrant consideration in the selection of abdominal incision, none is more important than the anatomy of the anterior abdominal wall. It is our purpose here to review with you some of the salient anatomical and topographical features of this area that will be helpful to you in the selection, extension, and the closure of these incisions.
Talking about Claude Organ is sort of both a pleasure and some remorse at his passing. He and I got to be very close in the last few years of his life and did some things together that I extremely benefited from and enjoyed. He used a phrase for me every time we talk about something serious. He said, "What's the right thing?" And that was an interesting definition. For him, the right thing was what was fair and equitable and appreciated all the interests and stakeholders involved. He just was a wonderful person, and I thought his theme and image of the latter part of his life was, what is the right thing? Let's do the right thing. He's a really great person and a great friend and helped me with hundreds of things.
Claude Organ Jr. was born in Marshall, Texas in 1928, the middle of three children to Claude H. Organ Sr. and Adelina Pemberton, and raised in Denison, Texas, in a family with a long history of and priority for academic achievement. Claude Sr. was the son of former slaves who were illiterate but still managed to buy a house and an 88-acre farm. Claude Sr. was the first Texas resident to attend and graduate from Lincoln University in Jefferson City, Missouri. Claude Sr. was a second lieutenant in World War I. After the war, his officer's training gave him a presence, the discipline, and an air of dignity that served him well against the constant and harsh racial treatment he faced in his supervisory position on a railroad mail car in the Depression-era Deep South. His son, Claude Jr., saw his father endure these indignities and learned valuable lessons that served him well. In the eyes of Claude, his father was a hero, much like Jackie Robinson, who is credited with breaking the color barrier in Major League Baseball, number 42. His mother, Adelina Pemberton, a twin, was one of a family of 10, all college graduates that became teachers, physicians, and a lawyer. She received her BA from Wiley College in Marshall, Texas, where her father, Henry Bertram Pemberton, was the first graduate, and her mother, Norella, was the first female graduate, who both became renowned teachers and were born into slavery. In 1894, Henry Pemberton mortgaged everything he owned to help build the first high school for African Americans in Marshall, Central High School, later renamed Pemberton High School. Adelina carried on the Pemberton legacy of teaching, but died early in Claude Jr.'s life from tuberculosis. The Pemberton legacy inspired him to achieve and teach, and heavily contributed to his teaching style that contributes to his renown. Claude received his education in the segregated public schools of Denison, Texas. He graduated valedictorian from Terrell High School. Growing up in Denison, the dangerous realities of racial segregation in the Jim Crow South were ever apparent. Claude and Adelina instilled in their 3 children a strong sense of dignity and self-worth that did not allow them to think of themselves as less than any other person, a belief that was integral to his approach to mentoring. 1944, Claude attended Xavier University in New Orleans, Louisiana. It was at this juncture that he was blessed to meet Elizabeth Mays. Elizabeth was a match, if not his superior, in every virtuous way. I was constantly intrigued by one student, Claude said, who always outscored me in chemistry, so I married her.
My name is Elizabeth Mays Organ, better known as Betty. I met Claude and his sister Claudesta the very first day I arrived at Xavier University in New Orleans, Louisiana, to register. Claude and his buddies were at the door of the gym looking over all the girls who were coming in. And he walked up to me and said, "What might your name be, Crab?" And I said, "I'm Crab Elizabeth Mays. I'm from Houston, Texas." And he said, and I asked him, "What might your name be, Mr. Worthy Upperclassman?" He said, "My name is Claude Harold Organ, Jr." And I looked at him and said, "Oh, I know all about you." He turned to his buddies because they all wanted to know, "What do you know? What do you know about him?" And I said, "You played in the band with my next door neighbor, Conrad Johnson, playing the bass fiddle. And you were just as arrogant as you could be." And he was smart, he knew it. But you know the rest of the story. Because he went on to be president of the American College of Surgeons.
Claude briefly returned to Denison early in his freshman year at Xavier to register for service in the U.S. Armed Forces. He was committed to pursuing a career in medicine, but faced steep obstacles. It was 1944, and heavy emphasis on training physicians for the war was well underway. He received a deferment to pursue his pre-med studies. After World War II ended in 1945, the only Negro medical schools, Howard and Meharry, were training physicians at capacity. Many returning veterans already had commitments from these institutions, and there was little thought that a black man could be admitted anywhere else. He saw no realistic chance of pursuing his goal in medicine. It was at this major turning point that his uncle Charles Pemberton assisted Claude in taking a bold approach during his senior year to rekindle his vanishing aspirations to become a physician. Under the guidance of Charles Pemberton, Claude applied to the University of Texas Medical School. With an impressive academic record, he passed the qualifications for admission, but would not matriculate because blacks were not allowed to attend. Upon graduation, he returned to Denison, biding his time teaching sciences at his alma mater, Terrell High School, letting the strategy unfold. Charles Pemberton enlisted the aid of Texas Senator Sam Rayburn, then the Speaker of the House of Representatives. They utilized a legal maneuver that was being utilized across the country, spearheaded by Thurgood Marshall, to enforce the separate but equal statutes enshrined in the landmark Plessy v. Ferguson Supreme Court decision of 1896. Charles Pemberton and Senator Rayburn persuaded the University of Texas of their legal responsibility to provide for his medical education as a Texas resident, since there was no separate Negro medical school in the state. The University of Texas Medical School offered to pay his expenses to attend any institution he gained admittance to. As circumstances would have it, Creighton University Medical School in Omaha, Nebraska, under the deanship of Reverend Harry B. Crimmins, embarked upon integrating their student body, the first U.S. Catholic medical school to make such a commitment. Aware of Claude's plight, Reverend Harold Perry of the Archdiocese of New Orleans, the first African American to serve as bishop in the Roman Catholic Church, recommended Claude for Father Crimmins' consideration. Father Crimmins was so impressed with Claude, he gave him an application, and Claude's dream became reality. He entered the Creighton University Medical School in the fall of 1948.
And probably my most favorite organism, which is a very powerful and prophetic one, he wrote in 1963 when he said, "Once they let me in the door and I learned the rules, I had two more responsibilities: to be excellent in everything I did and to show others the way. I believe that your presence here today is a tribute to his life that he lived. Thank you very much."
Excel he did. His sister Claudesta noted that it was at Creighton that his passion for medicine took flight, particularly during summer externships that he arranged in Houston with Charles Pemberton, and the extensive pathology that he was exposed to. These early clinical experiences formulated his desire to take care of the whole patient, to become a general surgeon. Betty had matriculated to Boston, being the first African American to be admitted to St. Elizabeth's Nursing School, graduating in 1951. During his third year at Creighton, he decided to marry Elizabeth, thus beginning a 53-year partnership. Claude graduated in 1952 and stayed at Creighton to train in general surgery. Claude continued to impress his professors with his breadth and understanding, clinical experience, and determination to be the best technical surgeon he could become. After completing residency and fulfilling his service commitment in the Navy at Camp Pendleton, he came back to Creighton and began an academic surgical career that spanned 45 years. From 1960 to 1982, he rapidly advanced through the academic ranks at Creighton University, the last 11 years as the chief of the Department of Surgery, building a top-flight Department of Surgery and a widely sought-after general surgery residency training program. From 1982 to 1988, he was professor at the University of Oklahoma and chief of surgery at the Veterans Administration Hospital. 1988, he took on a surgery residency training program and surgical service at Highland Hospital in Oakland, California. William Blaisdell, then the chairman of surgery at the University of California, Davis, stated, quote, "I can't think of any situation more politicized and unionized. The surgery residency program was hanging by a thread with the threat of closure by the RRC," end quote. Claude rapidly built up the faculty and shored up the residency program, developing it into another widely sought-after general surgery training program. As L.D. Britt noted, the surgery residency received commendations for a program of excellence in Dr. Organ's final review by the RRC.
I remembered back to my first experience with Dr. Organ in the operating room, which, like all of my memories of Dr. Organ, is indelibly printed in my mind. But more than anything, what I remember about that day is watching Dr. Organ operate and thinking that In many ways, it was like watching an elite athlete or a concert pianist in terms of economy of movement and real gracefulness, without wasted movements and without hesitation. And also the way in which the room was an orchestra, and he was clearly the conductor and the master and commander of that room. And so I think it's very fitting that these surgical suites are named in honor of Dr. Organ, for all the teaching and all the excellence that he instilled in the rooms. I think that as a former trainee, that I will carry the lessons he taught me really throughout my life, and I consider his teaching one of the greatest gifts of my professional career.
I had a unique relationship with Claude because I knew him at this little-known Jesuit school in Omaha where I went to medical school, and he was early on a teacher and a mentor of mine, and I never forgot that. He then, of course, moved to Oakland, and I helped him with his residency program there with some of his residents that came to San Francisco for training. But my greatest pleasure was assisting Claude achieve his goals as president of the American College of Surgeons. And he wanted to make certain that his year as president was remembered as the year of the resident, namely to make the college really relevant to the young people who are entering this wonderful profession of ours. And I think he truly turned the college around, and for that I am most grateful. When he retired and he attended his last Board of Regents meeting 1 year ago, almost to the day in New Orleans, so much has changed in 1 year, he was presented with a lovely crystal in celebration of his many years of dedicated service to the American College of Surgeons. And on that crystal there was inscribed from William Jennings Bryan a saying which I think really sums up Claude's life very appropriately: that destiny is not a matter of chance, it's a matter of choice. And it's not a thing to be wanted for, it is a thing to be achieved. And I think we all agree that Claude Organ achieved so much in his lifetime and was able to realize to its fullness the destiny of his life.